But with the melanin meter, what we get is we have a number between 0 to 100 from the area that we are going to treat. Each area we are going to test it again. We'll get a number, we'll feed this to the screen, and the device will give you the preset of pulse width, rate, energy. This will create high safety protocol. That means you are not guessing anymore, because there is a lot of different tones and shade between skin type 4 to 5, 5 to 6. Also, you have pigmentation in hair follicles, and a lot of unexperienced users will make a mistake by choosing the wrong energy setup. This is the key thing to ensure safety in our protocols. Use melanin meter, each area measure it, and get the energy that you need. So what about acne vulgaris in Asia? So globally, acne vulgaris is the 8th most common skin disease. 85% of adolescents will have at least one-time acne, and 30% of them will have acne scars. In Asia, it depends on the country and also the climate. In East Asia, China, Japan, Korea, it's between 15 to 20% of general population.
所以我们总结一下，就是当强脉冲光治疗的时候，我们必须明确皮肤的病理生理，如何降低这个色素的风险、色沉的风险，如何提高疗效，如何提高病患的一个依从性。影响疗效的因素有选择的滤光片、脉宽、能量密度、脉冲数、延迟时间，还有病变的性质、皮肤的类型、治疗次数的多少等等，还有因为这是个散射光，所以操作的技巧也非常的重要。当我们这选择碰到问题的时候，我们该怎么去选择呢？就假如你想治疗更激进的话，我们就选择增加能量、缩短脉宽、缩短延迟时间、减少脉冲数，用短波的手具。反过来，当皮肤的治疗过于激进了，我们想温和一些，我们就是减少流量，延长脉宽。
We have a first-line therapy. We using a topical medication like hydroquinone, kojic acid, azelaic acid, or tretinoin, or we can combine 2 or 3 or more topical medication to improve the effectiveness. And the second-line therapy, we can use a chemical pill, especially glycolic acid and TCA. And for third-line therapy, we can use IPL and laser, especially laser toning and IPL for vascular component of melasma. And for me, my treatment strategy on this patient is combined treatment as well. And before give the treatment to the patient, the first thing that patient education is very important to me. We need to help them understand that melasma is a chronic and relapsing condition, so they can learn how to live in harmony with melasma. And combine treatment is my priority. And on this patient, for melasma, I will combine topical medication with chemical pill, IPL, and laser toning as well. And for her lentigen, I will use laser KTP 532 nanometer to remove lentigen.
ALA or MAL for acne is very effective, and a successful rate is so long. So I'd like to your experience of IPL PDT experience. And second question is for rosacea, IPL is very useful, but it is not the first choice treatment in my case, because rosacea is an inflammatory disease. Patients tend to have very sensitive skin. So you have to be used carefully, because when the case, some cases get worse when we use IPL in the beginning. So I want to know your opinion, 2 kinds of things. Okay. So how about rosacea?
With rosacea, we have 0 side effects with what we do, because it also depends on the severity that the patient arrives. From the first moment, I'm telling you, I'm not curing your disease. You also need to watch out from the sun, triggering factors, because it can happen all the time during the year for different people. From the moment I'm telling him what I do is I reduce the symptoms, but it's good enough for them, because they come to me after they tried all the potential drugs that they have in the HMOs, all the topicals, and nothing worked for them. They do the treatment, we start once a week interval, and according to the results, we start to open it to once every 2 weeks, once every 3 weeks. We do the entire face. If you want to give another higher fluence, we use the stencil fluid with the gel to clear it out. But it's almost immediate response. Now, if in Asians, luckily, you don't have beard like European people. So males can have treatment for all over their cheeks. In European